Sucralfate is a medication that is used to treat and prevent ulcers in the intestines. It works by forming a protective coating over the ulcers, which helps to prevent further injury and allows the ulcers to heal more quickly. It is important to take Sucralfate as directed by your doctor, usually on an empty stomach, 1 hour before meals and at bedtime. The dosage will vary depending on the severity of the ulcers and your individual medical condition, so be sure to follow your doctor's instructions carefully. When taking Sucralfate, it's important to follow your doctor's instructions. Usually, you will take this medicine on an empty stomach, at least 1 hour before a meal, 2 to 4 times daily. The dosage will be based on your medical condition and how you respond to the treatment. Make sure to take Sucralfate regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Even if you do not feel ulcer pain, keep taking this medication unless your doctor advises otherwise. It may take 4 to 8 weeks for your ulcer to heal completely. Some medications may not work as well if taken at the same time as Sucralfate, so you may need to take them at a different time of the day. You can ask your doctor or pharmacist for help in creating a dosing schedule that works with all your medications. You can use antacids with Sucralfate, but make sure to take them at least 30 minutes before or after Sucralfate. If your condition lasts or gets worse after taking Sucralfate for 4 weeks, be sure to inform your doctor. If you experience constipation, dry mouth, upset stomach, gas, or nausea while taking Sucralfate, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience persistent fullness in the stomach, nausea, vomiting, stomach pain after meals, or difficulty swallowing. While serious allergic reactions to Sucralfate are rare, seek medical help immediately if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Remember, the benefits of taking Sucralfate have been carefully considered by your doctor, and they have determined that the benefits outweigh the potential risks of side effects. As always, it's important to follow your healthcare provider's recommendations for taking this medication. Before starting Sucralfate, it's important to let your doctor know if you have any allergies or if you're allergic to Sucralfate. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney problems, swallowing problems, stomach or intestine problems, or if you use a breathing tube. If you're planning to have surgery, make sure to inform your doctor about all the medications and herbal products you're using. Older adults may have a higher risk of developing high aluminum levels when using Sucralfate with other products that contain aluminum, such as antacids. If you're pregnant or breastfeeding, consult your doctor before using Sucralfate. Now, let's talk about the uses of Sucralfate. This medication is used to treat and prevent ulcers in the intestines. It works by forming a protective coating over the ulcers, allowing them to heal. It's usually taken multiple times a day, on an empty stomach, and at least 1 hour before meals. Be sure to follow your doctor's instructions on the dosage and optimal timing for taking Sucralfate. When taking Sucralfate, it's important to be aware of potential drug interactions. This means that Sucralfate may affect how other medications work, or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Sucralfate include antacids that contain aluminum, certain antibiotics, such as ciprofloxacin, levofloxacin, ofloxacin, and tetracyclines, digoxin, ketoconazole, levodocaconazole, penicillamine, phenytoin, quinidine, and thyroid medications, such as levothyroxine and liothyronine. It's important to discuss any potential drug interactions with your doctor or pharmacist before starting Sucralfate. They can help determine the best time to take this medication and ensure that it is safe and effective for you. If you or someone else has taken too much Sucralfate and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. So, your doctor may suggest some changes in your lifestyle to help with the treatment and prevention of ulcers. This could include things like stress-reducing activities, changes to your diet, and getting regular exercise. It's important not to share this medication with others, as it's prescribed specifically for your own condition. Always follow your doctor's instructions when taking Sucralfate. It's usually taken multiple times a day, on an empty stomach, and can be taken with or without food. Be sure to take it exactly as prescribed for the best results. If you forget to take a dose of Sucralfate, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. It's always best to stick to the regular schedule. It's important to store Sucralfate at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of Sucralfate, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it's expired or no longer needed. If you're unsure about how to dispose of Sucralfate, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.